Good morning, everyone, and welcome to the first grand rounds of our 2023-24 series, and a special grand rounds because it's not only our opening, but our William Womack Memorial Grand Rounds. My name's Carol Rockhill. I'm one of the psychiatry faculty members and planners of the Grand Rounds series. So a couple of things I wanted to highlight that there is a paper copy, and there also in the invitation is an electronic copy of the schedule for the season, which has traditionally gone through June, but we've also added an August Grand Rounds meeting. And I also wanted to thank Michelle Kuhn and Mindy Manjares, who were co-planners of the Grand Rounds series, and also to shout out Catherine Sweeten, who's here in the front row, who's our Grand Rounds coordinator, and to tell people that we have a reception following this Grand Rounds presentation, and it's in Ocean 7 in the cafeteria area. So please feel welcome to come. And I'm so pleased that there's so many people here. I think that's a testament to our speaker and the relationships he has with people here at the hospital. And just really glad to see people in person as well as many people online. There is a sign-up sheet if you want CME credit out in the lobby. So shouting that out. I want to start with a land acknowledgement, that we acknowledge that we're on the traditional land of the first people of Seattle, the Duwamish people past and present, and we want to honor with gratitude the land itself and the Duwamish tribe. And we do acknowledge that, of course, this does not take the place of authentic relationships with Indigenous communities, but it's just one way to honor the land we're on and to resist cultural erasure. And we also acknowledge that this country exists and prospered as a result of free enslaved labor of Black people, and honor the legacy of the African diaspora and Black life, knowledge, and skills that were stolen due to violence and systemic oppression. We also affirm our commitment to be aware of the privilege and oppression and how they play a role in the lives of our patients, families, and employees as we strive to be anti-racist and to improve the care for those who have less privilege. And I also want to shout out that it's National Hispanic Latinx Heritage Month from the 15th of September through the 15th of this month. So today I'm going to introduce Chris Varley, who's going to speak about Bill Womack, who this Grand Rounds lecture is in memoriam of, and then he'll hand off to you, Larry, to introduce Dr. Danielson.
Good morning. I'm looking over at the list over there on the wall. I'm very much hoping that we were able to make a connection for Bill's daughter, Lisette, who has been very instrumental in the conversation that Carol and Elizabeth McCauley and I and Bill and Larry had about the initiation of this lecture kickoff for our Grand Rounds. And Lisette has been one who's had considerable agency in this process. In following in the tracks of her father, I never know where Lisette is. And last year, I think she joined us from Paris. And I believe she is in España ahorita in Madrid. And so the time zone is favorable. And so I'm hoping she's there. There was a problem with the link, but hopefully you're here, and good afternoon. Lisette, who, by the way, is going to be joining our Big D department just maybe now. So it's a wonderful addition to that. I'm honored to talk to you a little bit about Bill. Most of you didn't know him, and I just wanted to tell you a few things about my friend and colleague. He was the first African-American faculty member in our Department of Psychiatry and Behavioral Sciences, and also in our Division of Child and Adolescent Psychiatry. He is one of the few people who had been in this department longer than Elizabeth and I had. He was in our department for 38 years and retired in 2007, I think. And he had stuff to do, and he did it after he retired. He died in 2020 at the age of 1984. He held a million positions within our department in our division. He was my division head for many years. He was also the head of psychiatry at Harborview. For a time, he ran the consult service here at Children's. He also was a prominent figure in juvie and was head of the mental health services in detention. He ran a clinic for stress management and taught our fellows about hypnosis. And so he really was, within our department, and I think in the conduct of his life, a Renaissance man. He had a national figure, a national set of roles that he was involved with through the APA and ACAP, and held leadership positions there. Most importantly, he was an anticipated and prescient leader in areas that are timely today and have even perhaps more weight now than they ever had, in terms of being an advocate for the BIPOC and LGBTQ community. He also championed kids who were underprivileged in other ways and wanted to provide as much as he could to them in terms of promoting access to care and promoting their well-being. He also was a flashy dresser, and I'm wearing this shirt in recognition of this. Hopefully Seth will approve. It's not Bill's shirt, but I trust that he would approve. And so I wanted to call that out. Again, we're honored to have Dr. Danielson be the third presenter in this ongoing program that we've developed in recognition of everything that Bill did, and trust that it will be a process moving forward, honoring him and carrying forward the tremendous work that he provided to us and to our community. So thank you, Bill.
Well, thank you, Chris. Thanks, Carol. I'll be very brief, partly because Dr. Danielson asked me to, and partly because he's the one we want to hear. So it's really a pleasure to welcome Professor Ben Danielson. He received his undergraduate degree from Harvard and his MD from the University of Washington. He trained in pediatrics here at Seattle Children's and joined the faculty where he's been a member ever since for quite a long time. He was for many years the medical director and the heart of the Odessa Brown Clinic, and he truly established himself as a champion of delivering comprehensive pediatric care there that targets equity and justice. He's received many awards in the pediatric jargon, TNTC, too many to count. But they really call out his longstanding excellence in teaching, in clinical care, in advocacy, and for his really undying devotion to calling out and addressing racism, and I think generally for just doing the right thing. He wears many hats in the community, and he's here today as the founding director of a program that we're very fortunate to have based in our department, Allies in Healthier Systems for Health and Abundance in Youth. And thanks.
It's very weird and wonderful to be here this morning. And I'm so thankful that folks were willing to show up virtually and in person. And I feel an incredible amount of love right now. And so it's making my voice crack a little bit and pause. I'm really honored to be in this space and have a chance to share a few minutes in discussion and contemplation with you. I know you know this, but this is a topic that is absolutely no easy answers, tight bows to wrap around things, or quick conversations. So if you feel uncomfortable or disconcerted about this at the end of the conversation, I actually think that's a good thing, that's maybe the way we should feel about this topic, this injustice that we call our criminal justice system that involves youth especially. I could not say no to the invitation to speak in a lectureship that is in the name of Bill Womack. I also knew I had to dress a little bit to show up right. Oh, wait a minute. Bill would say I was not complete. Yeah, okay. Bill would definitely approve of that shirt. I think he would have added a few chains or other garlands to it. My wife, Kim, her only complaint of Bill was that his cologne was sometimes like at a 9 or 9.5. But I have really great memories of the bit I knew of Bill. I didn't know him as well as other people. I did have wonderful experiences with him, and he meant a lot to me. Just to see him in this space meant a lot to me. And he was all over the place, professionally, geographically, in so many different ways, artistically. But it always felt like he was also in the right place at the right time. And we probably, I don't know if others know him that well, but we all have our little stories and experiences. I was so pleased when Lisette made a bit of a website in his honor and created some images of him. And under that sign of that adorable young man there, full of brightness and future, you know, William Martin Womack Academic Course, Theater Guild, of course, National Honor Society, NAACP, Le Cercle, France Chronicle staff, ambition to become he wanted to be a doctor since he was 5 years old, I think, since he was really young. He was just becoming a Renaissance person in everything that he did. He was growing and changing and learning and did so many different kinds of life, so many different experiences. And man, he loves his daughter. I remember when I was new to being an attending physician here in Seattle. And this is an embarrassing story in a way, but it feels like I should share it. I grew up in a space and place where calling the police was like something you just never did. It wasn't a safe thing to do. And I kind of had maybe built up a bit of hubris or something in my life. I was in a new city, progressive place. I was a person with like a few letters after my name now and stuff. And I don't know, it was all whatever. So there came a moment when I was in a situation where I watched something happen where it seemed like I should call the police. And I hesitated. And this was right just a few blocks from here. But I decided to call. I called the police. They came. And the short of it was I ended up in the back of the cruiser in handcuffs. And before I was placed in that cruiser, I was up against a wall being frisked. And I could see as someone else who worked at Children's Hospital drove by and looked at me. And there was this piece of just pain and shame. And like, I couldn't believe that I actually called the police and I was the one that was suddenly in this position. And it threw me pretty hard. I then carried on my way to work and came into the hospital. And one of the people I ran into in the hall was Bill Womack. And right place at the right time. He was the person I needed to see. And we talked for a little bit. Bill sometimes didn't say a lot and said a lot at the same time. He showed a little bit of anger and frustration and really talked about dignity in a way that later on, when I started working at the Odessa Brown Clinic, I heard come up again and again. He talked about the importance of really continuing to do the work that you believe in, even when it seems like people are sending you messages that they don't believe in you. And he talked about also the importance of just knowing yourself no matter what happens around you. And if you knew Bill, he knew himself no matter what. And then he had me kind of smiling by the end of that. And he had this really weird laugh. You had to hear this laugh to know. And he had me chuckling with him. And we didn't talk all that much over the years, but every time I saw him, I knew I saw somebody who saw me and who knew me. And I owe him so much for just being here today is because of someone like that. Having somebody that knows you, that looks like you, that sees you, that maybe has done much more than you could ever do, but is still willing to kind of pause and take a moment and support you is what life is about. And maybe it's also what this topic is about how we need to be seeing each other differently, how we need to be changing the ways in which our norms and practices drive us to be something other than I think our deeper human values tell us we want to be. Wanted to share that about Bill. And I hope he gave me permission. I hope Lisette doesn't mind that I also used her picture here. If you're out there in Madrid, lo siento mucho, Lisette, but muchas gracias también, because it's really important for Bill to be in this space and in this room today. That's lovely.
Thank you so much. I don't know if you can hear me, but somebody unmuted me. So thank you so much. I really loved everything you shared. And
thank
it's
you.
totally fine to use that photo.
So we're going to talk a bit about AHSHAY today and some of the intentionality around it, and just some of the curiosities and some of the things that have sort of prompted its development. I'll also say that this work has really been in partnership with a lot of a small number of really, really wonderful people. One of them is with us today, and it's Brenda Mayerchen, who's been a really strong partner in developing this work. And thank you, Brenda, for everything that you've been doing. The idea of really trying to take something horrible and painful and bringing a beautiful voice to it, seeing us strengthen something, actually understanding that there is still power and abundance and possibility, even in some of the worst and hardest spaces. It's just so important for us to remember. The idea that if we are people who care about wellness, who are in the work of providing and supporting health to especially our youngest people, that this is actually the work that we should care about, maybe more deeply than just about anything else that involves a stethoscope or a prescription pad. The idea that we can be creative and thoughtful, even in the space and time when it feels like an enormous problem is facing us. That is what it means to be human on this planet. And that is what it means to think about problems that feel really hard and just to keep working on them and trying to find better ways. I hope that makes some sense. And I hope that's sort of a little piece to the purpose. But it is hard work, and it takes this ability to find your voice at times. It takes this ability to sometimes work deeply in partnership within systems. I work with police in a pretty regular way today, and it's still not comfortable, but it is the important thing to do. Work across and within systems, to stand outside sometimes and yell at the top of your lungs until your voice is as hoarse as Bill's laugh, and also to be within systems and sit and listen and be willing to hear an opinion that's different than yours. That's what it means to try to do something that's challenging and hard. And it's important to know that this is not just about some lofty idea or some ephemeral or mystical kind of sense of purpose. The issues of racism and oppression in this country are so real. I was looking at this study this spring that looked at the cumulative numbers of excess lives lost, which is a weird term to me just to begin with. Excess mortality, as if something got dropped on the floor or some accident happened. The number of unnecessary deaths in this country for Black people in about a 20-year period is 1.63 million lives lost. 1.63 million people who deserve to continue to breathe, who have things to give and support and have brilliance to share. As a pediatrician, I was also really struck by the number 80 million years of life lost, which means that out of those 1.63 million lives lost over 21 years, a lot of those lives were young people. Were young people who had so much more to grow into, to know, to grow through, to forgive and be forgiven for, to become better, to become brilliant, to share brilliance, to have their brilliance be seen. This is important work. It's not just about an idea or concept. It's not just about a bureaucratic issue. It's not just about a challenge about a system or a set of systems. These are lives. And these are lives of quality and a history of erasure and depletion and the robbing of culture and identity and purpose and connectedness and family and stories and legacy. These are real things that we talk about when we talk about taking on issues like youth incarceration and the disparities and inequities that happen within our healthcare system as well. It's not just about lives lost. It's not just about cultures and lives erased. It's also about the experience of just living under the gaze and the scrutiny of racism in this country. The idea that walking through the doors of a large institution, a corporation, a building like this means something different if you're Black. Calling the police means something different if you're Black. Deciding whether or not you're safe or not in this society means something different because you're under a scrutiny, under a gaze, under an eye that's wishing to see you do something for which you can be criticized, something that makes it look like you failed, something that makes it look like you could be labeled as bad or evil for the rest of your life. I often ask in conversations like this for people to raise their hand if they want to be judged forever by the acts that they committed when they were 14 years old. I don't think anybody's ever raised their hand. And yet that is systematically the way that we permeate and place a sense of permanent judgment on lives through that scrutiny. It's saying these things, and it's hard sometimes to disagree with them. It's hard to say no in the face of maybe facts and numbers and experiences and the things that you all know in your hearts and souls as well. But change is really hard. Getting systems and systems of people to change their behavior is just so extremely difficult. I was thinking about this quote from a guy, David McRaney, who wrote a book said something about "you're not so smart," which really is about how our heads and brains get in our own way of changing our minds and making different decisions. And this line about until we know we're wrong, being wrong feels exactly like being right. The level of defensiveness with which someone will stand in a space up until the very brink of some overwhelming something, making them realize that what they've been doing is wrong. It's a really incredible barrier. It's an incredible hill to climb. It's an incredible challenge to see that kind of change happen. Maybe you have experiences like that. Maybe you know of how that works and how that doesn't work in our systems. It's hard to get minds to change, even in the face of sometimes overwhelming evidence. And then when things do get towards change, when people do get motivated, when something starts to create that critical activation energy or mass, all too often, our attention span is pretty short. And we start to think that something that is important or was important last year or was important 2 years ago is no longer of significance, is no longer of import. I'll pause and say, I'm really impressed in many ways with the Department of Psychiatry on this measure, the deep regard for action that has been baked into efforts that really did spring out of perhaps an overwhelming moment a few years ago. The kind of change that is more than words in some flowery statement, more than some good intentions, but actually looking at ways to reflect, rediscover, reform, transform. This work is so important And even when you get through a time of sustaining effort and through a time of seeing that overwhelming evidence, it's still sometimes hard to change because we can create in our mind oh, I should have warned you, I make up words a lot. But enormizing beyond redress, creating a sense of a problem being so big, so gigantic, so difficult to take on, or maybe seeing ourselves as so small, so minuscule in proportion to those challenges, that it allows us to say, I don't need to take effort, I don't need to do something because the problem's too big. These kinds of things are just really hard for us, and I'm super embarrassed for putting these in really, really corny, lazy layman terms in a space that's really about a profession like psychiatry and psychology that really understand these issues much more deeply than me. But this is sort of one way of sort of thinking through, why is it so hard for us to do the right thing in this country, in this space, at least in the spaces of society that I know of? Why is it so hard for us to understand the ways in which oppression and racism really affects our lives so much that it hurts us and it hurts the people around us? Oppression affects every part of our lives. If you are the person who is more likely to be targeted by police, have security called on you in an organization, have things happen that really try to undermine your well-being, your health is also being undermined by everything else, by the ways in which climate change affect our environment. If you're Black, if you're poor, if you're from a marginalized community, climate change is affecting you more than anyone else. I was looking at this chart, by the way, a map that the university's environmental sciences department helped put together. This is not a map of how hot it got during this summer on its hottest days. This is a map of how hot it stayed during this summer on its hottest nights. The idea of no relief from heat, especially in the Northwest, the idea of no relief from heat and the way in which it maps directly to the same maps of where youth are most likely to be arrested, where disparities in health outcomes are most likely to be disparate. The idea of the synchronicity of harm that happens across our societies. And I also just wonder about what it feels like to have no relief from heat as let's say as a young person, trying to navigate a space of limited resources and how these things overlap and pile upon each other and what they ask of us. No relief, no economic relief, no opportunity to build wealth that is a ladder out of some situation. It is intentional that the opportunity for Black wealth in this country is kept at a very flat line. It is intentional and not by accident. It is synchronous in the experiences of people that the opportunities to send somebody to college, to have a home that you can pass on, to build wealth across generations is curtailed in this country based on racism and other factors. It's not an accident. There are designs, and there are designs that really perpetrate scarcity as part of their model, that convince us that there are limited resources that make it okay for us to make decisions that harm other people, that perpetrate scarcity disproportionately on those who already experience scarcity, that make it seem like this incredible country with incredible resources of brilliance, number one, of different lived experiences and talents and abilities to just transform the world, of resource, of straight up money, has to come from a space of scarcity to make sure that those resources are really held in a certain small set of circles and not shared in the ways that I think we feel our values would drive. All of this is designed. All of this is also perfectly designed. There's nothing about this that is a broken or flawed system that actually needs to be repaired. I spent way too many years talking about broken systems. Absolutely not broken. They're working exactly the way they are designed. So we humans created systems that are working perfectly, that are creating great harm for our fellow human beings. And we have to sit with that and live with that and understand that and know the power that baked into that really enormous statement is also a really enormous capacity to make something different happen as well. It's so important, and I keep trying to learn and remind myself that in the context of all of these conversations about injustice and harm, there are still these beautiful, brilliant, talented, incredible people at the heart of it. People who if I were stacking up the scales, whose assets are just so much greater than any of the deficits by which we describe them. Communities with so much more to give and offer, so much more capability, so much more abundance than we sometimes describe in our problem-oriented world. I mean, let's break it down a little bit in healthcare. We actually title ourselves based on deficits, don't we? Like there's like a director of mood and anxiety disorders, not a director of joy and thriving life. We are structured to create a working practice in this room, in this space, in this field, in this world that is really based on really just acting on deficits and not captivating, capturing, or working in the space of abundance in the ways that we could. And all of this and all of my own like needing to look at myself really deeply and wonder, like, where am I complicit? Where am I helping? Where have I let families down that I should have been a better person to? Where have I not been active in the ways I needed to? Went through a lot of deep reflection, and it really started to make me want to look at this thing called juvenile and youth incarceration differently. The overwhelming evidence says that youth incarceration doesn't work and causes harm. Reform efforts have done incredible things to reduce numbers of incarcerated people. Yet those strategies have also made greater racism show itself in the outcomes that people have. The access to reforms, the access to other opportunities has been really not fairly or justly distributed across populations. And our incarceration system is a flywheel that spirals downward. It adds trauma to people who have already faced trauma, doesn't help create any kind of societal contributors or improvements, and it shortchanges the real idea maybe of justice. And I mean like the kind of justice that means accountability, acknowledgement, healing, the reinfusion of hope and forgiveness. When we do meetings, sometimes we talk about some of the hardest things, don't we, Brenda? Like we open up with questions that are really difficult, and sometimes we choose them for their difficulty. One of the hardest questions in a number of different like workshops and things that I do is around forgiveness. When I ask somebody to share a time when you've forgiven somebody, most people draw a blank for a long time. And then the best answer that they can come up with is often, when I was 11, ... When we were young, maybe we had some moments where we forgave. Our adult practice of forgiveness, of understanding, of helping people through transgressions or failures or hardships is really challenged. I wonder sometimes how we could cultivate a different level of understanding and forgiveness across our society in different ways. The foundations of youth detention are rooted in racism. The practice of separating youth from their families is inhumane at its roots, and its roots are also based on slavery, enslavement, and the practices of erasure and cultural appropriation and erasure that happens in our Native American boarding schools. When Black and Indigenous youth are arrested or come in contact with the juvenile court system, they're less likely to be offered the kinds of programs that might actually be an alternative to incarceration. They're also 3 or 4 more times likely to be detained than white youth in the same position or in the same action for the same activities. Youth detention ignores what we know to be true via science and through the lived wisdom that communities have known forever. Washington State, a child as young as 8 in progressive, politically correct Washington State, can have criminal charges brought against them. And efforts to actually overturn this have failed repeatedly. A young teenager can be charged as an adult, sometimes as young as 12, actually. Charging youth as adults fails to recognize what I think a lot of you know in your professions about the possibilities of brain evolution and growth. I had a really weird conversation last night about how I don't like the idea that a young person's brain is just not finished developing yet. I really do think young people are brilliant just in their own right. I also think their brains are really different. And there's a way to think about those brains as different, and therefore our approach to justice should be different. But that doesn't mean that we have these sort of like easy bake oven, still cold in the center kind of brains that haven't finished developing yet. Our brains evolve all the way through the course of our lives. But I wonder if we're saying something wrong or different when we say somehow a youth's brains are underdeveloped. They're differently developed. They're differently evolving. And that fact, that point, allows us to maybe say, we're not going to take away the agency and the voice and the power of youth voice, because to say that they're undeveloped brains is sort of to say that they don't get to have a say in what's been happening around them and to them. But to say that their brains are different says that an adult approach to punishment that is purely punishment-based is actually not the right way to approach a brain that is evolving and developing differently. I don't know if I said that the same way last night, but it's kind of the point. Harmful systems seek out harmed youth. I used to hear all the time working in communities that this phrase, hurt people, hurt people. And then watching again how that really centers this particular behavior. Hey, Janelle. Janelle is also one of the AHSHAY team members, one of our managers. You have to wave and say hi and clap for Janae because it's great to see you. Appreciate you. Hurt people is a really important way to center still the locus of the issue, still these individual people. I think about actually how systems actually seek out people who've been hurt and seeks to hurt them again and again. That's why if you age out of foster care, you're way more likely to end up in prison than you are likely to go to college. And you're way more likely to go to prison several times and be cultivated from a youth or young adult incarceration experience to an adult incarceration experience. Our systems seek out harmed youth and try to hurt them more. 25% of youth arrested within 1 year of aging out of foster care. 60% of youth in detention centers have not been convicted of a crime. Think about that for a moment. This is true in adults too. Most of the people who we have taken their freedom from are actually innocent if we still believe that you are innocent until proven guilty. Each day of pre-trial detention, if you're in detention awaiting trial, one of our colleagues, Sarah Walker at the CoLabs at the University of Washington, did a study that showed that every day of being in pretrial detention, there's a 1% increase risk of arrest in the following year. And the duration of time that youth have been held in pretrial detention has been going up significantly over the past couple of years, especially. So youth incarceration does not reduce recidivism. It actually increases it. Diversion programs in our communities have proven to reduce recidivism. Victims often don't feel incarcerating youth is really a form of justice. So for the families that we have labeled as harmed by youth for actions that they have done, 75% of the time in national studies, they do not agree that incarcerating youth, even as victims of those crimes, the way those labels are used in this country, they still do not agree that incarcerating a youth is the right way to approach it. Offering services in detention, as wonderful as those services could possibly be, as absent as those services might be in other parts of community, the idea of offering them in detention does not justify detention. It's not a reason to remove somebody's freedom, to take them out of community, to put them in jails and put bars on their windows and doors. Offering great services is not a reason to justify detention. In fact, most of the time, it seems like those services would be much better used, much better offered, and much better in terms of effectiveness and return on investment if they were offered in community instead. Now, the youth detention system is weird and complex, and I won't pretend to fully understand everything about it. And I think it's really hard to wrap our minds around what really happens in this country. Also, I was told by the organizer of this lecture that in order for you to get full CME credits, you'll need to at least a few slides with either pie charts or graphs on them. So we're leaving the world of beautiful art to help convey images and stories and going to the world of beautiful numbers to help convey experiences and stories. Here's one. Here's a look at all the different ways and places that youth can be locked up in the United States. The wide ranges of different forms of loss of liberty that we can impose on young people across a host of different systems and different methodologies. Some of those numbers probably actually overlap for some people. But the way this works is pretty complex. It's also really based on the way we've approached adult incarceration and punishment. Looking at that, it makes it really hard to tease out how focusing on one particular small sector is actually going to do anything other than maybe change the shape of those pies a little bit, but not actually fundamentally change and transform the way we approach the idea of a young person having an opportunity to grow past and through an experience rather than become labeled forever as a criminal. We're really good at incarcerating. You've seen probably graphs of how many adults we incarcerate compared to other countries. And the same is pretty much true for our extraordinary ability to incarcerate young people in this country compared to other countries. But reform has really worked. And I'll share an embarrassing thing again. As an abolitionist, I was kind of judgy for a while about the idea of reform versus actual abolition. I kind of thought reform was a really good way to waste time and not make a lot of progress and sort of get into minuscule measurement of change rather than getting into big transformational change. And this has sort of proven me wrong in a lot of ways. It's really interesting for me to think these are the numbers across the country of youth incarcerated over the course of 2001 through 2019. And it kind of marks a little bit of some of the time that I was working at the Odessa Brown Clinic. And when I started there, the Youth Detention Center, which is, I don't know, is it 5 blocks from our clinic? Maybe, you know, Garfield's pretty close, but it's also very close in terms of what options a youth sees in their life as the next thing as they grow up. Those numbers have really come down. When I was at the Odessa Brown Clinic in the first year of medical directing and started visiting the primetime program that the department has been doing at the detention center, there were 200 young people in that detention center on any given day. By the time 2019 came around, there have been days when there were 10, 15. Reform works. If I were standing in front of you and talking about abolishing youth incarceration, and in our communities, every day we saw a facility that had 200 youth incarcerated in it, the ability to envision not incarcerating youth is really hard when there's 200 in a prison right around the corner from you. You get to 10. I could see 0. I could see us not having that happen at all. Reform works in ways that are really important. And I have really had to start to appreciate that reform plays an important role in helping us envision the possibility of actual abolition. The numbers have gone down. If you look at it for 100,000 population youth, the numbers have gone down even more significantly as the youth population has grown. But those numbers go about to 2019. They go right up to the shoulders of COVID. And then as we head into COVID, different things start to happen. Most importantly, though, the numbers flatten out and then they start to rise. In 2019, there were days at our youth detention center when there were maybe a dozen young people there. Today, there are 65 or 70. The number has gone steadily back up. And not only that, the duration of stay has been the greatest factor in making that number greater. There are young people, or mostly the reason that they have a mental health condition, that have been in that youth detention center for years. Youth detention is supposed to be like a 2-week prospect at most. And even as we've gotten to smaller numbers, actually the racism has actually gotten worse. As of January 1st, 2023, Black youth were almost 10 times more likely to be detained than their white peers. Prior to the pandemic, we always used the number of a 6-to-1 ratio, 6 times more likely as white youth. In the Northwest, that number is even worse. It's 11 times, actually. This is the numbers for our region, where the disparity is now 11 times greater compared to 6 times in previous years. We're not going in a direction that is actually promising in this work. I wonder sometimes, as we lose our focus on the work that we felt like was important, does our short-term memory start to impact the way that we can sustain change? King County made a commitment in the heels of George Floyd's horrific murder to close the youth incarceration center, youth detention center around the corner from the Odessa Brown Clinic by the year 2025. I don't know what all that means. I know for Brenda and I, it was a spark to try to either, I don't know, cast aspersions from the sidelines and say like, that is just something that a politician said, and of course that's not going to work. Or to try to really go all in and see if there are ways to put every bit of effort that we could to support brilliant people who've been doing this work forever, to try to make sure that that we have done our best, have worked as hard as we could to see progress and change. It's an opportunity. If for some reason there was greater success in this work, the model that would come out of a place like this, and maybe a couple of other places in this country, could be the kind of thing that could spur and inspire the changes in every jurisdiction to really get to a place where we ended youth incarceration. That's the hope. So we started a center. I'll just say, I really wanted it to sound out the word AHSHAY. So I kind of twisted myself in a backflip to get some words together to sound out AHSHAY, because AHSHAY is this voicing of the possible, an amen in some ways, praise be it, and from if you put it into the universe, then that means it might just happen. AHSHAY is a phrase that Black communities, African communities, and other communities use to just say, yeah, like right on. It's like a version of that. So every day I get to say AHSHAY many times over and over. The idea was to build sort of two locations in the start, one in the Department of Psychiatry and Behavioral Sciences at the University of Washington, and one in the Rainier Valley at the Tubman Center for Health and Freedom. And the mission of AHSHAY is to build up the fortifiers in health and hope for youth and unbuild the fortifications of youth imprisonment. The name AHSHAY doesn't say prison, because really envisions the absence of that in our society instead of the presence. Trying to do something counter to this medical thing where we name ourselves based on deficits and diseases. And the vision of AHSHAY, which is maybe still a work in progress, so Janelle, don't judge me too much in putting this up here for everyone to see, but envisions and expects a society where our youth's ability to thrive is so cherished that collectively we celebrate youth brilliance, give youth what they say they need. Racism is actively rejected, and harms like incarceration are deemed unimaginable. Our approach is really to try to coalesce wisdom to support and the wisdom that's been working for a long time, and maybe de-silo some of the wisdom that has been working in its own little spaces at different times and different places. There is a piece of instilling the health perspective, because I still think even as the criminalizing justice system talks about things like brain development and a public health model and trauma-informed practices, those are still mostly They feel like words and not like actions or actually built into the systems and the approaches. The idea is also to work on today and tomorrow, that you can do a both and, that you can be about taking something away, but if you only take away and you don't talk about what you need to put in, what you need to create, then maybe you're only doing half the job. The idea is really to get from this to this. And it's really hard. Even in the first year or so, so many difficult conversations come up. Brenda, Janelle, and I have talked a lot about when you get into communities, especially communities outside of King County. If you go to Walla Walla or Aberdeen, especially say Aberdeen and a few other communities, the best possible job that you can have as an adult, the kind of job with benefits, health insurance, an IRA, and a chance to send your kids to college, is to work for a prison. So the conversation about abolition has to start from a different place and has to carry a different kind of respect for the conditions in community that drive it, so that we have communities in this state where the best job is a prison job. Understanding that means not accepting that as the way that things should be, but as the way that they are and the way that we need to be working from. Hard conversations, different languages, different approaches. I've found that talking about dignity is a much more interestingly received conversation than talking about anti-racism in some communities. Not because I'm afraid of talking about racism, but because I'm trying to learn how to enter into conversations that allow people to share and exchange and share their views. And so far, I have not found anybody who has a real issue with the idea of dignity. It's pretty easy to talk about that. And what I find is when you talk about dignity, you're actually talking about anti-racism. You're actually talking about pro-Blackness. You're actually talking about pro-LGBTQ2 spirit plus. You're talking about those things. You're using the words dignity. But these are hard conversations. The hardest conversation and the quickest thing, and I'll bet the thing that some minds even in this space go to is, but what about that youth that kills somebody? What about that youth that does a heinous crime? How could we not have a prison for that? Those are hard conversations, and I don't necessarily try to dissuade somebody from that worry or concern right away, because I think that that would just create someone with a resistance to any further engagement or conversation. What I will say, if we were still talking, is that if you actually care about reducing the chances that a young person will murder another young person, do not incarcerate youth. That sounds weird, but that is everything that the data says. That is everything that wisdom and what we know about this process and this practice really tells us. That is as true as you could get in understanding these dynamics. If you really wanted to impact heinous crimes that our society deems are done by young people, stop incarcerating young people. Feels weird, doesn't it? It's true, and it means that we need to be approaching things in a very different way. It's really hard these days because also conversations are creeping very strongly, last year especially, into crime wariness in our communities, across our societies. Our newspapers get really good, our online news gets really good at highlighting how much crime is happening. Our perspectives about why that's happening then suddenly jump to reinvesting and militarizing forces within our borders in order to take on our Black and Brown communities. These are hard conversations. They're very difficult. In Black communities, the concern and perceptions about crime are very high and are very worrisome. Having conversations about this are not easy. There's not a quick, like, by the time your coffee gets cold, we will have figured a very common answer to this. But it is important for us to be having these conversations. And anyone who's willing to have these conversations, I'm so thankful for that, because that means you're touching into some of our deepest feelings and willing to share some of the things that are important to be talked about. Does that make sense? That's a piece of what AHSHAY is about. Just trying to create space for those conversations. We also hope that we do this work that's both upstream and downstream, and that is essentially grounded and informed and centers the voices of youth, especially youth who are closest to being impacted by this issue of youth incarceration. As we've grown and started to do our work, it looks kind of like this. We have this sort of dyad of unbuilding the fortifications of imprisonment, which mean more than just imprisonment, but all those pathways that seem to push towards imprisonment, and building the fortifiers of this other thing, this other set of societal and community resources that makes the idea of youth incarceration unimaginable. Work with the county's plans to close their detention center, work very closely with detention center staff as they plan for this decommissioning of the youth detention center, work on policy reform supports. Washington State has done some amazing work in policy reform and just continuing to support people who are doing that work. Work on gun violence reduction, because the intersection of gun violence and this issue of youth incarceration is so tightly woven together in our society. And work on state level reform efforts, like with the Partnership Council on Juvenile Justice, because everything from informing policy to actually informing the way the day-to-day work happens at the state level and throughout its offices. We also work on building the fortifiers. One of the most important is really building up youth leadership and the sense of youth really knowing and owning their futures in a powerful way and being led by that. Also have projects like the one Janelle is leading around fortifying futures for our youth. Also doing things like helping to understand the landscape of resources and the ways in which people are connected and the ways in which communities actually could find themselves reaching out for different kinds of resources rather than relying on a criminal justice system to incarcerate young people. And supporting other community programs that have been doing brilliant work for a long time. And they've been doing nation-setting kind of and data-driving kind of approaches to what they call diversion, which seems weird to me. I wish it were like, what's the term for the thing that's the main thing you do instead of the thing that's the alternate thing you do? Is there a word? Main version? Let's call it main version. I told you I make up words. So working on things like main version. I'm serious about making up words. We had a retreat the other day. Instead of calling it a retreat, though, we decided to call it a joyference because one, we were not retreating from this issue, and two, we wanted to make it full of joy, not about like suffering. This is what the work looks like, and this is what it means to be doing that unbuilding and that building. This project that Janelle is running is really interesting to me because it's really focusing on cultivating youth voice and building some relationships across communities by a number of people who are working together to try to move a little bit away from the acute problem-solving nature of our approach to crisis-oriented issues in our society and stepping back and actually talking about what would be the beautiful other thing that we should be working towards instead of just the things that we're running away from. And through that process of bringing people together, a little bit of, I'm gonna like sort of give away my age here, but a little bit of Gilligan's Island approach where you kind of force people to kind of be together and problem solve together and think together and find their abundance and their joy rather than just the deficits together. And through that, well up a number of incredible creative ideas that are from the community and vetted by youth. And then by involving donors and philanthropy in that work from the beginning, really call on those donors to continue to invest in that work. That's the sort of model that we sort of developed this project around. Cultivating upstream, acting on the direction provided by youth, engendering relationships, and really relationships is the coin of the realm and the outcome that is the most important piece that we hope for, and really try to hold a space for abundance. The reason we're trying to do this in a different way than most projects is that most projects have gotten the same results over and over again where we are, but also because complex issues need something other than singular sets of predetermined solutions in order to get there. And that relationships may be the most important thing to allow people to actually work through challenges and work better together. And it seems like an opportunity to really live into the phrase and mean it when we say that those most impacted know best how to address change. That approach is really important to us, and we're cultivating the idea of relational instead of outcomes-oriented approaches to problem solving and taking on challenges. It's a cultivar, a space for emerging ideas to find fertile ground and grow. And so we don't name what those outcomes are beforehand. We actually leave it to this space of this group of partners and these youth to really drive what those solutions look like. And then we look for basically actionable abundance out of that work. We also know that, that we're really looking to work towards what's possible, not deal with the scarcity mentality of what we can't do because of what is present right now. This work is really important to us, and it frames the way we approach everything about AHSHAY. The meaningful power becomes noticeable. Communities evaluate their own work and understand whether it's about making a difference or not. The success can look different than the ways in which people who have traditionally planned the way reform should happen actually decided ahead of time. The transformation might come from a very different approach, but might be promoted and inspired by the ways in which past approaches to reformation have occurred. Abundance axis, relational flywheel, getting the momentum going, and then getting into implementable ideation. And we have this sort of model of these youth groups, this core group of community and other folks together in an outer circle of advisors. And I'll just say really quickly, it reminded me of this shape, which started to remind me of the logo for our AHSHAY Center. So our AHSHAY Center and its logo really is about this co-created projects through relational work that has this abundant upstream lens, in addition to doing all the other work that's about unbuilding and things like that. Try to do these projects that allow us to sort of ask important questions from those build projects and programs that really help support a different kind of future. I'm going to take a moment because this is Bill time. Bill was all about style and how you get to the presence and the approach that you had. All about style points. So the style points for AHSHAY. This is for you, Bill. We were really inspired by the idea of Sankofa, the Sankofa bird that really says you have to go out back and get it. You have to understand your past in order to know where you are in the present and to be able to move into the future. This country is really good at about not understanding our past and repeating those things over and over again. So the idea of Sankofa, especially when it comes to our youth, feels especially grounding and important to us. So we're promoted and we're prompted by the concept of Sankofa, something you can look up and talk about and think about more. We're also, as we started to create our own idea of identity and image, thinking about what kinds of colors and what kind of a palette really describes AHSHAY. So eventually we were deeply inspired by the work of Jacob Lawrence and the color palette that Jacob Lawrence used in his style points. And I think Bill would be proud of the idea that we were thinking about incorporating art and artistry into the work and the practicalities of our efforts. So we came up with this sort of Sankofa meets Jacob Lawrence and kind of colors and schemes, and we started to build from that. And as of just a few days ago, we have a website. And we've developed some of the content and construct behind that website and what it starts to look like and how it starts to evoke the feelings that we want to present and promote and how we want to do our work. We're also being grounded by really thinking about the themes that really help us to move forward as a group of people, as a caring group of people who want to do positive work together. So we've been really centered by this book called The Four Pivots by Sean Ginwright, which asks you to do a lot of personal reflection, asks you to start to understand how you incorporate your work into the work with others and take away some of the layers that get in the way of us doing good work together, and eventually help you to move from kind of turbulent hustling, which makes us all exhausted in this society, to laminar flow, which helps us do incredible things together. That's the work. There's some resources there and some other things. But the work is really about saying that we believe in young people and that we care about what can happen and that we defy the laws of gravity in a particular way. Because I think that our society, I think you are exhausted by oppression. I think you're super tired. And part of that is because we are all practicing the art of holding people down. And contrary to gravity, I think it is easier to lift people up than it is to hold them down. I think our work would be lighter and more beautiful and more amazing if what we were doing was lifting people up. I think we have opportunities to practice that and live into that and make that actionable, make that part of our workday every single day. And I also want to make one last admission. This phrase, "it is easier to build strong children than to repair broken adults," is supposedly something that Frederick Douglass said, but he never actually said it. There's no place in the literature that shows that Frederick Douglass said anything like that. But the spirit of what he meant by that was something that was captured and was brought on and carried on. And I think that we all have ideas and themes in our hearts that maybe we don't always express in the way that we want to. I'm the most clumsy speaker ever, but we know it's in our hearts. And we see each other's hearts, just like Bill saw my heart on the day when it was really suffering and hurting so many years ago, and saw something different possible even in the moment that was the most painful. And so I honor Bill, and I'm so honored to be with you. I'm so glad to be back in this space with you particular people, because we are all that we need. And I'm so happy to be able to work with great people on a project called AHSHAY and try to do something meaningful rather than sit by and decide that no meaning can come from the way our society currently exists. Thank you.
Thank you. That was a really heartfelt talk, and really appreciate it. We have about 10 minutes for questions, and we can do a combination of questions in the chat and questions in the audience. And so I'd like to open it up if there's anyone who has a question or comment in the audience.
No guarantee of good answer.
I'll start with a comment, which is definitely not a question, but much of what you said applies to the mental health system.
Yeah.
And I was really struck by your pie graph, so I can get my credit, but the fact that there was, residential treatment was a huge part of that. And we have no data to suggest that those are useful interventions. So trying to think positively. There's a tremendously joyful task that we have in front of us.
That was well said. I love that. Elizabeth was also one of the first people I got to know when I came to Seattle Children's Hospital. So it is full circle fulfilling to be in space with you today.
Good morning, Rima Ellard with the Foster Care Assessment Program. Thank you so much. I'm feeling kind of burnt out, and I needed that. So thank you. I was thinking a lot about diagnosis, given my world and in child welfare and where we are. And we see how negatively impacted children and youth are in the child welfare system with the diagnoses that our society must give youth in order to provide services. And I just wonder, in your world, how you see that impacting incarceration.
As a pediatrician, I really found, because I'm not that smart, that it's really wonderful to wait for a parent to have their own answer to a question that they have, and then just like be able to applaud them for it. So I feel like you are kind of naming something that you understand and have an answer to as well. So I won't take it any further than that, unless you want to make more comments about the tragedy that is baked into this deeply interlocked set of systems between diagnoses, especially in the mental health realm, and incarceration in many different ways, right? Sometimes there are some folks from privilege who get diagnoses that allow them to avoid incarceration. Sometimes there are ways in which diagnosis actually helps lead to systems of denial of freedoms that either is part of incarceration or is its own form in many different ways too. And there are parallels across a lot of spectra. This idea of getting away from the moment a little bit and really thinking about what we could be investing in at the same time. I keep thinking about that. I work on the grants part of the Partnership Council for Juvenile Justice at the state level. So decide how many state dollars go to promising community programs. So much of the time, those dollars and those programs are only allowed if someone's already been arrested, if somebody's already had a conviction, if somebody is already incarcerated. Those programs would be so wonderful if they were offered way, way before that. The idea that you need, I'll call a diagnosis of a crime in order to access programs and services that are really wonderful is really shameful. And I think it's also true of the way in which we create gates and barriers before you can access other services as well. I'm not answering your question because I think you had the answer when you asked it. But if you want to say anything more about that, I would welcome it.
Hi, Ben.
Hi.
I wanted to share that also, just like you were inspired by Bill, I feel like as one of you were one of the first attendings that I got to work with as a resident here in general pediatrics. And absolutely, you know, you inspired that sense of dignity with every patient that you saw. And I will always remember patients that I got to share work with you in seeing and caring for, and how
Me
much
too.
that really means to those of us that you have helped train and continue to do so. So thank you for the inspiring talk, the beautiful slides and art that you shared to really help us center these important areas that we're doing. And I'm curious, as you mentioned, the American Academy of Pediatrics chapter worked hard on the policy around youth being as young as 8, being convicted of crimes in our state. And I'm curious if you could just speak to how much some of those policies are a barrier to the work that you're doing. And my sense is that perhaps there is hope that we're going to be able to change some of these policies that are barriers, but just wanted to hear a little bit more about that and kind of galvanize, continued work on that for all of us to advocate for those changes.
Well, I reluctantly admit it in the face of a camera and many witnesses, but I think it was you who actually instilled in me the value of really seeing the dignity in people too. So maybe there was a shared bi-directional thing. And I always appreciate the way you've approached your work and your ability to work within and along systems, but still see very clearly what should be, not just live with what is. And I saw you nodding when I was talking about the 8-year-old policy, because I know you and others worked pretty hard on that and continue to work for those changes. And those reforms are extremely important. There's incredible space for us to actually do so much more to really change the way that we create rules that trap youth and allow for especially youth of color to be entrapped in those processes. I think about reforms and policies. I also have become aware of the ways in which discretion is just so powerful. Even as we make changes to rules and reforms, when there's space for someone to make a decision like arrest or not arrest, charge or not charge, upcharge to the highest possible charge, like charge as an adult versus not, or automatically recharge, like for some really minuscule violation of parole or something like that. As long as that discretion exists, racism fully flowers. It's amazing to me. I used to want to think that discretion allowed for like our better selves to make better choices. What I've seen in so many places is that discretion creates a lot more ground for people to be biased. And I wonder how we create a set of policies that really help us address that. But I think your point is really important, that there's important work for us to be doing and raising awareness of, which I think is one of the best things that the AAP has also done, because I don't think pediatrics is involved enough in this issue. I know also the AAP is not ready to jump onto an abolitionist space necessarily like where I am, but I also deeply respect the approach to reforms and the use of the credibility of pediatrics to actually name what's right and what should be done in the name of reforms. And so I think that's a really powerful thing. And I hope it grows and I hope it's strengthened because it's one of the ways that we start to approach and are able to envision actually never incarcerating young people.
I think we have one final question and then we'll wrap up and transition to the reception where we can continue the conversation.
Yeah, so far there's just lots of messages of gratitude to Ben, and Lizette did say, thank you, Dr. Danielson, for your important work and powerful and inspiring messages, and for honoring my dad so beautifully with your personal stories of him. So glad I was able to join from Spain. My dad would have loved this talk.
Wow. Thank you.
Okay, well, on that note, we will end this portion of the Grand Round celebration, and I really invite everyone here and everyone virtually who's nearby enough to come to the Ocean 7 cafeteria space to continue the conversation.
Yeah, if you have more questions or just want to chat about this issue, this topic, if you have things you want to share, please come up to Ocean
7,
yeah,
the cafeteria area. I did want to highlight one thing about the Grand Round schedule, which is that next month, the November talk will be at our new Magnuson outpatient space on Sandpoint Way and 70th, rather than in this physical space, but will also be online. But thank you very much, Dr. Danielson. This was an amazing talk.